Good to meet you. My name is Randall Garcia, and I am the owner of Medicare Pro. And today, we're going through a no-nonsense, straight to the point, no fluff, Medicare 101. I believe it will answer all of your questions, and especially if you're new to Medicare, maybe you're confused about Medicare, this is the video that should give you about 99% of everything you need to know in regards to the basics. So I want to dive right in and make sure that we get right into today's session. All right. So we are Medicare Pro, and first I want to start with who we are. We are an award-winning, licensed, certified, rigorously trained, and independently owned insurance brokerage specializing in Medicare. Faith-based, family-owned, passionate about serving our community, honest, friendly, down-to-earth, and always helpful. And we're professional. So this is super important to me before I get started, so you know that you're getting the correct advice, because unfortunately, people get incorrect advice. And so this is who we're not. We're not salesy, pushy, or dishonest. We're not a telesales center. We're not somebody who tries to twist your arm to enroll in a plan. Actually, I would say that our job is, as Medicare independent agents or brokers, is to advise you on what plan to choose from. But you have to understand the basics first. So I like to say we make Medicare easy. And if you're watching this video, this will answer your questions to make Medicare easy. Now, I know what you're thinking, because everybody says, nope, that's impossible. You can't make Medicare easy for me. I'm just way too confused. I'm actually here to tell you, no, we're going to make it easy. So please stay until the end, so that way we get all the way through this. And so the way that we make Medicare easy is we love educating our customers. It starts with educating our customers. Education is key. Before we talk about your plan selections, we have to understand some basic frameworks of Medicare. And so we know that if we do our 4-step process, you're going to get everything you need from A to Z. We're going to get all the T's crossed, all the I's dotted when it comes to your Medicare. So here's our 4-step process that we use. And we love the phrase, let us help put you at ease. So if you're sitting there, you're going to be put at ease with this 4-step process. It starts with education. Well, that was hard to guess, right? And then it goes to analyzing your plan options. And then we help you select your plan and then enroll. That is what we say, let us help put you at ease. And so we take you through this process so that way everything makes sense. So let's start with educate. Okay, so here's the overview of where we're going in the education part of this. The first part is we're going to go over Medicare eligibility. What is original Medicare through the government? What is a Medicare supplement versus a Medicare Advantage plan? What are the enrollment periods involved? And that's going to answer so many questions for you. So the first thing is eligibility. How do you get Medicare? Well, there's really 2 ways: by turning 65, or there's people who are under 65 who have certain disabilities that gives them Medicare. Now, Social Security needs to determine that. And maybe you fall into one of these categories. How do you enroll into Medicare? Well, you enroll through the Social Security website 3 months before your eligibility date. So if you're turning 65, let's just say in 3 months, well, you're in your time frame of enrollment. So you want to do that about 90 days in advance before your Medicare begins. Go to the Social Security website, go in person, or call over the phone to start your process. Now, some of you who are already taking Social Security income benefits may get Medicare automatically, but it's always good to check first to ensure that everything is all right with your enrollment and that everything's ready to go by the time you need it, all right? So original Medicare. Let's talk about this card right here. This is called Original Medicare, your Part A and your Part B. You can notice Part A is your hospital coverage and Part B is your medical coverage. What a lot of people don't know is some people have just Part A, Some people have just Part B, but most people have both. You definitely want to make sure you have both when you're selecting a plan option, and we'll get to those plan options in a little bit. Let's start with the basics. On Original Medicare, that red, white, and blue card right here, we're going to break down what it costs and deductibles and things like that. So Part A is your hospital coverage, and you should get that for $0 a month, okay? And this asterisk down here below the line, this becomes zero monthly premium for people who've earned Medicare Part A by working 40 quarters. So Medicare Part A, you earn it by working, okay? But some people will pay $285 a month for Part A, and other people will pay $518 a month for Part A. But as long as you've worked your 40 quarters, you're going to get it for $0. Of course, these other situations only apply if you've worked less than 40 quarters or less than 30 quarters. But most people get Part A for $0 monthly premium. Now, if you use your Part A, your Medicare red, white, and blue card, let's say you go to the hospital, you're going to pay $1,676 for your admission. It's a deductible. It's what comes out first before the insurance kicks in. And so that will cover you for 60 days in the hospital. And then after day 60, you can see on the top right of your screen, you're going to pay $419 per day, days 61 through 90. And then after day 90, we're at the bottom of the screen. After 90 days, it's $838 per day for 60 lifetime reserve days, which means you can extinguish those days since you only have 60 lifetime days beyond 90. Now, don't worry, this is just Original Medicare. When you get to plan options, they kind of supersede some of these things and protect you from accumulating medical bills. But this is just Medicare by itself if you did nothing. And let's go to Part B, your medical. Part B, the standard premium is $185 per month for 2025. Now, this changes every year. In 2024, it was $174.70. It went up to $185 for 2025. Who knows what it's going to be like in 2026? But that's what it is, $185 a month. Now, this number, this monthly premium, usually gets automatically deducted from Social Security, okay? From your Social Security check on a monthly basis. But some people, if you're not taking Social Security, you'll get a quarterly statement, a quarterly invoice from Medicare, and they're going to want you to pay $185 times 3. But if you're taking Social Security, it's just automatically deducted from your check. Now, one more thing to mention with this $185. I called it a standard premium because this premium can go up or down based on your income. It will go up if you're making hundreds of thousands of dollars in a year. I'll show you that chart later. But if you're making a lot of money, that's an IRMA, income-related monthly adjustment amount. And so you might pay more than $185, but you've got to be making more than $100,000, $200,000 depending on the situation. People can also pay less than $185, and that's when they qualify for a Medicare savings program. These are programs that are meant for low-income individuals that will help reduce the $185 to $0, but you have to qualify based on your income. In fact, I'm going to give you those income limits later as well. But that's the standard premium. For the sake of this, I'm going to go with the standard premium, $185, even though you might be in a different situation. We could talk about it individually, but let's go for the standard just for this presentation. If you go to the doctor with Part B, then you would owe a $257 deductible per year. That's annually. That's not every visit. It is once in the year, and then you don't have a deductible anymore for medical. And after you've met your deductible, Medicare begins to pay 80%, and then you would pay 20% of whatever the bill is after that. So now we can get into supplement versus advantage. okay? Medicare supplement is also called Medigap, and we're going to call this option 1. And option 2 is Medicare Advantage, which is also called Part C. Now, this is where people get confused because some people say, if you're looking on the left side of your screen, I don't want a Medicare supplement, I want a Medigap. You know what I would say? That's the same thing. Tomato, tomato. Or some people say, I want a Medicare Advantage plan, I don't want a Part C plan. I'd say, that's the same thing. Like some people call me Randy, some people call me Randall, but I'm the same person. Different names in a way, but same person. That's just like these terms. And so this is why people get confused, because there's so many terms and terminologies used in Medicare. I don't want you to get confused, though. Know that these are the same thing. 5 things to remember with Medicare supplement. The first thing that you want to remember is that Medicare supplement is a secondary insurance plan. Okay, so let me talk about this for a second. You have your red, white, and blue Medicare card, and you say, hey, here you go, doctor. Here's my primary insurance. It's Medicare, the red, white, and blue government card. Then you would say, and here's my secondary insurance, which is my supplement. And so that's what you need to know with Medicare supplement. It is a secondary to Medicare. Medicare remains primary. If you keep it this way, then there's no network and no referrals. A lot of people forget about this. Why is there no network? What do you mean? There's no HMO, there's no PPO? No, there's no HMO and no PPO on this side because Medicare is primary. The government, the A and B is primary. So you would just ask your doctor, do you take Medicare? And then the secondary would be obligated to pay the difference. So there's no network and no referrals if you do it this way. I do want to mention that you would also need a prescription drug plan if you do it this way. But number 3 here is in your first 6 months, you see this OEP. What does that mean? What is OEP? Your open enrollment period for Medicare would actually be the first 6 months that you're eligible for Medicare. You can get into a supplement with no questions asked. They can't ask you health questions. They cannot deny you. They must give you your policy. But after your first 6 months on Medicare, now you would be entitled to underwriting, health underwriting, where if you wanted a supplement, they can ask health questions, okay? Premiums. Number 4, premiums are based on your age and your zip code. So the premiums vary. I'd have to give you a quote personalized by your age, by your zip code, if you wanted a Medicare supplement. And then again, number 5, Part D is sold separately. So you need to remember that would be your third card. Medicare would be primary, your supplement would be secondary, and then your Part D prescription drug plan would be your third card that you would have. And that would be for your pharmacy or prescription benefit. Here's a few things to remember about Medicare Advantage, and now you're going to start seeing the differences. The first thing I want you to remember is that Medicare Advantage, or Part C, combines A, B, and D into one plan. So you can imagine the Medicare Advantage, this is where everything gets combined into one card. Instead of having a primary, a secondary, and a drug plan, no, you have one card that does it all. It's your hospital coverage, it's your medical, it's your prescription coverage, and much more. That is what Medicare Advantage does, and when they do that, they put you into a network-based plan. So you're in a network, and there's different types of networks. There's an HMO network and a PPO network. PPOs are known to be a little bit more flexible. HMOs are known because most HMOs require referrals for you to see a specialist. So your primary care doctor would need to give you a referral on an HMO. Now, on either of these options, you have to continue to pay your Part B premium. What is that number? It's the $185 that we see above in the top left of your screen. Most Medicare Advantage plans will come with dental, vision, hearing, over-the-counter. There's a lot of things. Every plan's different, but they have a lot of these extra benefits that really are useful when it comes to your coverage. And then finally, it includes financial protection. So that's important because if something catastrophic were to happen, you're covered by Medicare Advantage. In fact, you're covered by Medicare Supplement too. But either way, whichever way you go, you're going to be protected financially from accumulating medical bills. So let's go to the next slide so we can dive a little bit deeper. Now, I'm about to give you some ballpark numbers. This is not for everybody, but I just kind of want to give you a general idea of what each side would actually cost you on a monthly basis. So the most popular supplement, in my experience, is a Plan G supplement. For a 65-year-old, it should cost ballpark, give or take. There might be a little lower, might be a little higher, depending on the company that you go with. Around around $120 a month is what you should be expecting for a Plan G. And if you buy this Plan G, why would you pay an extra $120 a month? Well, because it pays everything Medicare doesn't except the Part B deductible. So let's go to the top. That means that your plan would cover your hospital deductible, that $1,676. Boom, that's covered 100%. The other costs on both A and B, boom, all of those are covered 100% by your supplement. The only thing that remains is a one-time per year $257 deductible. So here's your coverage. A lot of people say, well, I need all my copays and send me the Plan G and what does it cover and what's my copay for this? What's my copay for that? No. Watch this. This is your coverage if you buy this. You have a $257 deductible and then you're done for the year. No hospital. You're 100% covered with hospital on day one. That's it. And then medical, you just have that $257 deductible once per year. You're done. All right, you don't need to go and figure out what's your copay for physical therapy and what's your copay for specialists. Nope, $257 deductible and you're done for the year. That's why people would pay the $120 a month for this kind of coverage. It's actually pretty good. Now we go to the next part down is your Part D. You got to remember the Plan G only covers what Medicare doesn't. So that means it only covers hospital and medical expenses. Part D is separate. Prescription expenses are different. They're in a different category. And so in 2025, we're seeing Part D plans all over the place. Some Part D plans are actually $0 a month. And then some are actually $80 is not the most. I know that there's some over $100 a month. If you're taking generic prescriptions, you can go with a cheaper plan, even do a $0 a month Part D prescription drug plan. But if you're taking very, very expensive medications, it may make sense to get one of these higher premium plans depending on your prescriptions. But don't worry, Medicare Pro can do a prescription drug analysis and make sure that we choose the right plan and save you the most money. Trust me. When it comes to the prescription drug analysis, you're going to want a professional to do this because it could literally cost you hundreds or thousands of dollars out of your pocket or in monthly premium that you wish you would have never paid. Let us do the work. Let us do the prescription drug analysis, give you the quotes, give you the numbers, and then we can make that decision together. All right, option 2. Let's look at the other side. What does Medicare Advantage cost? Well, HMOs will have a 0 monthly premium. Remember, HMOs need referrals. Referrals are required, and these are $0 per month plans. And HMO, it stands for Health Maintenance Organization. So these are organizations that help maintain your health, which means your doctor is a part of an organization, your primary care doctor, where they say, you know what, doc, you're in charge of the maintenance. You're in charge, you need to do screenings and labs, and you need to do all these things. And you're going to be part of this organization to keep people healthy, okay? This is an insurance organization or a healthcare organization to keep people healthy. Doctor, you're in charge, all right? And this is why referrals are necessary on an HMO, because in order to do health maintenance, well, they're going to need to keep tabs on you and know where you're going and who you're seeing and what prescriptions you're taking. And they're going to need to have constant communication back and forth. I'm going to be honest, in my experience, just getting started in insurance, I didn't really like HMOs. But now I see the reason behind it a little bit more. Now, are referrals fun? No, nobody ever really says, oh, I love referrals. But what a lot of people do is they opt for an organization or the healthcare side of things where all of their screenings and things are taken care of. They're lower copays, so they save money. A lot of times they get more extras like more dental, more vision, more hearing. And most HMOs will include Part D. Really, almost everyone does, unless you are in a special situation. Okay, so that is an HMO. Now, what is a PPO? It stands for Preferred Provider Organization. Now, these are the more flexible plans, and so there's really two types of people now. You have the HMO person that says, Doc, you're in charge and I trust you. Do your thing. Send me where I need to go. You're in charge, Doc. And in turn, I'm going to save some money, get some more benefits. But then there's the other kind of person who does a PPO. And they're more of like the person that would say, no, Doc, I'm going to go where I want to go, when I want to go. I'm in charge and I'm going to do my thing. That's a PPO person. So you can choose either. That's the good news. But for PPOs, people, they love that there's no referrals required. So they can show up at a specialist and not have to go through the referral process. Now, there is a trade-off. When you get that freedom, the copays are a little higher and there's less extras in most cases. So there is a little trade-off where you might pay more or get less, but that's the trade-off. You're either going to go with an HMO for the benefits or you're going to go with the PPO for the freedom. We can always compare and contrast exactly how much those copays are, but that would be a one-on-one conversation. Here's some enrollment periods that you need to be aware of. I'm going to first start with the Medicare Supplement or Medigap. This is not the Medicare Advantage. This is Medicare Supplement. Here's a few enrollment periods. The first one, we talked about this earlier. The Medicare Supplement Open Enrollment Period. This is not annual. In fact, there is no annual enrollment period for supplements. This is a one-time per lifetime window. So the first 6 months after you get Medicare, right? That's your open enrollment period. You can go into a Medicare supplement with no health questions asked. Guaranteed issue periods. This is special circumstances where you cannot be denied coverage, like you're leaving your employer, you're retiring, things like that. There's some guaranteed issue periods that you can get if you have a special situation. Otherwise, you're going to need to go through number 3, health underwriting, where they ask a bunch of health questions and they can accept or deny you based on your health conditions. And I've had so many people get denied for so many different things. You definitely want to call to make sure before you fill out the application and then get denied. Also, every company's underwriting is different. Some are more lenient and some are not. And so, reminder, Medicare supplements have no annual enrollment period, okay? And also, if you're doing your research, I don't want you to get confused, but if you're turning 65 after January 1st of 2020, Plan C and Plan F are not available to you anymore. They have been phased out for you. The only people who can get them were people who were 65 before January 1st of 2020. Medicare Advantage has different enrollment periods. So the initial enrollment period is when you initially get Medicare. It's 7 months long. And so really it's the 3 months before your birthday. Let's say you're turning 65 in June or something like that. You're going to do 3 months before June, the month of June, and then 3 months after June. It's a total of 7 months in your initial enrollment period. Annual enrollment period is October 15th through December 7th. Guess what? This happens annually, and you're going to see all the advertisements. You'd have to be living under a rock to not know it's the Medicare annual enrollment period. I'm telling you, I watch TV, I listen to the radio, I do all that, and I see advertisements like crazy. You will too, and it's just how it works. And all of these companies are going to be soliciting you, wanting you to change to them. Be very careful during this period because this is where I feel like the misinformation is flying off the shelves, and you don't want to be caught up in misinformation. Number 3, Medicare Advantage open enrollment period. That's different than annual enrollment. Open enrollment, annual enrollment, they sound the same, but they're different. The open enrollment, we call it OEP, is January 1st through March 31st. So actually, if you're already on a Medicare Advantage plan, you can change to a new Medicare Advantage plan. So you kind of have 2 periods. They're different. The annual enrollment period is where you're allowed to do more choices. The open enrollment period is only for Medicare Advantage members. And then there's special enrollment periods where if you have a special circumstance, they may let you change your plan in the middle of the year, meaning like you retire, you lose coverage of some sort, you move out of the plan service area, you get extra help or Medicaid, maybe you have a chronic condition that qualifies you to change plans, or maybe you have a 5-star plan. This is a short list. There are so many special enrollment periods. We want to make sure you're aware of them. So the next thing that we do is we help analyze your plan. And so what we do is we look up your doctors. Which doctors do you have? Primary care, specialists, dentists. We'll look them all up for you. Prescriptions. All right. If you want to get ahead of the game, give us your list of prescriptions so we can do that prescription drug analysis. Help and savings. What does that mean? Well, this is for people who feel like maybe they might qualify for some help from the government if your income's under a certain amount. And you could see at the top of this page, it says 2024 because they don't usually release this until several months into 2025. As of this recording, it's December of 2024. They have not released anything for 2025. So I'm going to give you the current numbers that I have. If you want to qualify for full Medicaid, this is QMB, all right, then these are your income limits as a single person or as a couple, $1,275 or $1,724. All right, and of course you can see the asset limits as well. There's other levels of Medicaid. That's full Medicaid. This is considered partial Medicaid, SLMB, and the income limits go up a little bit to $1,526 as a single person or $2,064 as a couple. As a single person for QI, that's also partial Medicaid. It goes up to $1,715 or $2,320. Low income subsidy. This helps with your prescriptions. It gives you a subsidy for help on prescriptions, $1,882 or $2,555. And to apply for some of these programs, you can go to yourtexasbenefits.com, or you can apply for extra help from ssa.gov. And also this 1-800 number is what we use a lot of times. It is a social service program by the WellMed Charitable Foundation, and they can help also see what you qualify for. We also want to go through conditions, okay? What conditions do you have? Diabetes, heart conditions, lung conditions. We want to make sure we have a good understanding of your conditions, so then we can help select a plan. So we filter options. We go through everything, make sure that out of the 100 plus options in where I live in San Antonio, there's over 100 options, San Antonio, Texas, or wherever you're at, that your doctor's prescriptions, everything, your budget, your situation, your conditions, everything's covered. We do that for you. Then we help you enroll to make sure that you're going into a plan that will not deny you. And here we go. Are you ready to enroll? Well, not yet, because I haven't done your analysis yet. But here's what we're going to need if you want our help. We want your Medicare card and a form of ID. Those are the 2 basic things that we need. And maybe you can shoot me a message. Maybe you can leave a Google review. Maybe you can do something. How did I do on this presentation? I says, I'm taking new clients. We are taking new clients. And you can refer us. You can contact us. If you look us up on Google, we are a 5-star Medicare business. And we are proud of that. Hundreds and hundreds of people have left us reviews, and I know you will be the next 5-star review. And can't end a presentation without John 3:16. We're a faith-based, family-owned business, and we're ready to take care of you. Now, For the most part, that's pretty much the presentation, but I do have a few things I need to add to complete it. So that's the basics. If you want to stay for 5 more minutes, now I'm going to get into some specific situations where I think you might need some help, some of you. If you have TRICARE for life, right? This is for veterans, people who've served in the military and earned TRICARE for life. You have options, okay? You definitely want to give us a call. I'm not going to go through these in detail because this doesn't apply to everybody. I have 11 reasons to pair Medicare Advantage with TRICARE for life and go through them quickly. There's no premium for you. Sometimes you get money back or dental coverage, vision coverage, hearing coverage, gym membership, over-the-counter items, worldwide coverage, PPO plan options. You don't lose your TRICARE benefits, and a lot of these plans are backed up by top insurance companies. General retirees, if you're retiring, I know I'm going through this quickly because these are special situations. If you're a general retiree, meaning you're retiring from a job, you definitely want to compare to make sure that either that you want to stay on your group plan or you want to transfer out of your group plan. Okay, and so I don't know what you're being offered, but you definitely want to make sure that you're not messing up coverage that you're offered in retirement. And we can review all of those options. TRS retirees, teacher retirement. You definitely want to compare because a lot of people need to know this. Once you leave the teacher's retirement, you cannot go back. And so we want to make sure and give you that. Income-related Medicare adjustment amounts. Okay, here's another appendix. So here are the income limits for income-related Medicare adjustment amount. Remember when I said that instead of the $185 a month for Medicare that gets auto-deducted from your Social Security, on the left column, you'll see individuals, and you'll also see couples who've filed joint tax returns. These are the income limits. You have to make over $106,000 or over $212,000 to get an income-related Medicare adjustment amount. And of course, it goes up from there. And then you can see your new premium on the right-hand side. So yes, you do get penalized the more that you make. This is also part of it. You will get a Part D income-related monthly adjustment amount. Next, Inflation Reduction Act. This does apply to everybody. So in 2025, there is an elimination of something called the donut hole. If you're not familiar, the donut hole was not good news for people taking expensive medications. Now there's an annual out-of-pocket maximum of $2,000. This helps people who are paying thousands and thousands and thousands of dollars on their drugs. Now there's a $2,000 cap. And if you need help with that, there's a new M3P payment plan option where you can actually split your prescription drug costs into payments. And so you just call your carrier, whichever insurance carrier you're with, to set up that payment plan. There is an insulin savings program. So if you're on insulin, you're maxed out at $35 per month for insulin. More people will qualify for the Extra Help program in 2025 than they ever have before. Vaccines are covered at zero copays, and manufacturer discounts and rebates will be made available for 2025. Whew! Wow. So that was a lot. Special situations, and to be honest, there's more than that. And if you have a special situation, what we need you to do is give us a call so we can evaluate and we can make sure that you're safe with your insurance going forward. But I do hope that this helped you, give you the basics. We've taken a little over 30 minutes to go through the in-depth view of Medicare. If you have questions, please reach out. If you have an agent with Medicare Pro, we'd love for you to reach out directly to your agent. If you aren't with Medicare Pro, we'd love for you to give us a call so that we can help you navigate through this very, very confusing journey in Medicare. That does it for the recording of this video and the Medicare 101. I know you learned a lot. I know you took some notes. Feel free, watch it over again. Send this to a friend, a family member who might be a little confused. This will set a lot of things straight, and they're going to thank you for sharing this video with them. Well, that does it for today. God bless. I hope that you have a great rest of your day. I know you learned a lot, and I look forward to hearing from you soon.